The excise tax on health-harming products like tobacco is a win-win strategy for public health, for government revenue, and for health equity. On tobacco, many countries are invested in taxing tobacco products with the most effective mechanism as recommended by ECOWAS, the World Health Organization, and IMF. Ghana currently implements the ad valorem excise tax duty on tobacco, which is not effective for revenue mobilization and keeps prices of tobacco very cheap, increasing the exposure to our children, the poor, and the vulnerable. Even though tobacco has no known benefits, they are widely available and sold in a single sticks on the Ghanaian market. Evidence shows that an increase will lead to a small change in consumption, but the revenue will increase marginally. This and some other reasons are why the Vision for Alternative Development is supporting the excise duty bill. Joining me now on Zoom to discuss this is Executive Director of the program Vision for Alternative Development, Labana Musa. Hello and welcome to News Night, sir.
Hello, and thank you for having me.
Right. Why do you support the excise duty bill? The concern has been that it will increase the cost of these products.
Right, so thank you for having me, and greetings to your cherished viewers and listeners as well. So indeed, let me start by saying that as I speak to you now, I'm not a happy person in Ghana here today because it is a bit very devastating. The fact that a bill that seeks to to promote health, to reduce the burden that the Ghana is currently facing with respect to rising cost of treatment, and then increasing rise of non-communicable diseases like diabetes, hypertension, cancers, and chronic conditions that we all know about. Indeed, again, the fact that a country that when COVID-19 came, the most people who were dying and falling ill and were being affected by this disease was as a result of people with underlying health conditions. So having said this one, it tells you that indeed these health-harming products are the risk factors to the diseases that were killing people when COVID-19 eventually struck. So for us as civil society organization, we were expecting that Parliament will embrace, this particular excise duty amendment bill. Embrace it and then pass it without any shred of, argument. Indeed, these arguments that you mentioned, these are, arguments and claims. In fact, let me say false claim by the industry who seek to, to look at the benefits that they would get from, promoting and selling their products. And they're not looking at the public health gains. They don't care about the individuals, and especially the way our children are exposed to these commodities. For others, while we are backing,
the reasons cited by the government, especially why this bill needs to be passed, many are calling that to increase government revenue, and also looking at the current state of the economy, revenue measures need to be put in place to subvert and support the budget in a way. Although you said health concerns are paramount at this critical time, what should be the opportunity cost, or what should we let go?
Right. So, in fact, I would say we should let go. Indeed, the industry claims, because as I mentioned earlier, the claims by the industry about hardship, the fact that it's going to increase cost of this product. Indeed, that is what, as a public health, person or activist, and indeed, this is what the global community is calling for, as you mentioned, WHO, UNDP, even World Bank are all calling for, an increase in these health-harming products. And the name is health-harming commodity. They don't seek to benefit us in any way. So the point is this: if government is able to increase tax on this, it does about four things. So first, it improves health and well-being of the citizenry. Secondly, it reduces the huge costs that normally the Ministry of Health, Ghana Health Service will spend, and including even National Health Insurance will spend to care for people who are dying from these diseases that I mentioned. And then also it reduces consumption to a large extent because, the target of the industry, tobacco, alcohol, sugar, sweetening, has always been young people, children who are coming up now because for me and you, if we choose not to smoke, we will not smoke. If we choose not to drink, we won't drink. So the target has always been. And then finally, it will also generate sustainable revenue to government, to support government intervention. The point is, for us, is indeed, taxes would not do only revenue, but it also, improve public health.
All right. Thank you, Labra Musa. Labra Musa is the Executive Director of Program Advision for Alternative Development.